What's up, beautiful people? Another day, another study. I love it when we have older medications that have been proven safe and effective, and we find that there are other uses for them. And this is the case with Azelastine, which is a antihistamine nasal spray. It's actually available over the counter. And previous studies have shown that Azelastine may help reduce respiratory infections, especially with viruses that are associated with colds. And it may do so through numerous different mechanisms, most of which interfere with how the viruses either enter our cells or how they replicate inside our cells. And previous research has shown that Azelastine may have efficacy against COVID-19. In fact, there were studies that showed that people who use Azelastine had lower viral loads, meaning how much of the virus was in their bodies while they were taking Azelastine. So this was a phase 2 randomized controlled study, 450 healthy volunteers, and they used Azelastine 0.1% 3 times a day for a mean duration of 56 days. And at the end of the study, they did see that there was a reduction in the overall number of COVID-19 infections and other viral infections in the Azelastine group. I have the numbers down below. And there's also lower symptomatic infections. Patients who had positive test results also had a shorter duration of positive test results in the Azelastine group compared to the placebo group. And then also the number of rhinoviruses, which is the other cold virus, was lower in the Azelastine group. And the total number of respiratory infections by PCR was lower in the Azelastine group. The great thing is the intervention was well tolerated, and the adverse effect profile was similar to what we've seen with Azelastine. Otherwise, mostly being a bitter taste and nosebleeds. No serious adverse effects were reported to be considered related to the treatment. So this is a really interesting study. I would love to see a phase 3, a longer study, also more participants in the study and using different populations maybe. But the thing is, Azelastine is cheap and it has a great safety profile. So I would have no problem prescribing this to patients who maybe have had numerous COVID-19 infections and want to reduce their risk, or for patients when they have COVID-19 to lower their viral load, and that can help reduce severity and also possibly reduce the transmission. So this is a really interesting study utilizing old drugs, repurposing them, and showing benefit. Have you used Azelastine or prescribed it for your patients? Let us know down below.